you to understand the drugs, you must understand the disease that happened in cardio. The disease, right? So I'm going to list the disease, and I'm going to then talk about the drugs, right? Now, in cardio, which is med-surg, right? We have these diseases. We have let me get black marker, this not dark. 706. Yes. In cardio, right? Cardio disease, cardio, heart. For you to understand how the drugs work, you must understand the disease. So I'm not going to go deep in the disease because I'm going to do that next Thursday. But we're going to go at least so you can have an idea of what drugs go with what disease, right? So the first disease a patient can have is what we call a clot, right? The second disease, the patient can have what we call CAD, which is grease, lipids. Come on. Then we have heart failure. Then we have hypertension. We have stroke. And stroke is a neural disease, but ischemia stroke is bulsan. It's a clot, right? Right? So when you have these diseases, right? Endocarditis, which are heart disease, we must treat them with medication. So, to understand the medication, let Miss Sonia give you an overview how the heart works. So, this is my ghetto heart. So, I do it ghetto style for the students to understand in a ghetto way. So, this is who I call Yaya. Yaya is you, me, a child, a person. A person who has some kind of heart problem. The heart is in Yaya. The heart is right here. All I did was separate the person from the heart. Now, in our heart, we have 4 chambers. Right atrium, right ventricle, left atrium, left ventricle. Those are your chambers. In our heart, we have valves. I call valves immigration. Why? Because you only can be in this country if you have the proper papers. Now, if I call the valves immigration, so that means certain type of blood can be in these chambers if you have the right kind of paper to be there. And the paper is called oxygen. Okay, so the heart has 4 chambers: tricuspid, pulmonary, mitral or bicuspid, and aortic. Anytime you have a murmur is like water flowing. Your problem is a valve problem. Anytime there is a murmur, 99.9, if you're not a child, You're an adult with a valve problem, you will always have a murmur. Okay? Now, then you see a big circle. And that circle is called aorta. And the job of aorta is to make sure this blood, the pressure is high enough to send this blood to hit me from head to toe. So here in the aorta, which come from the left ventricle aortic, aorta, there's a percentage, and it's called ejection fraction. Ejection fraction has to be 55% or higher. If ejection fraction is low, that means the heart is not pumping strong enough to send this blood to produce this pressure to cover me from head to toe. Any question? Now, the first disease is a clot. Bunsan. You can get this clot from not exercising, from hypertension. You have a bull. DVT, a clot. Right? Bunsan. Jamaican students say bull. Bull. Right. Clot. When you have a clot, I am going to break it. With which type of drugs? Anti-Coagulant. So the first category of drugs on page 706 is called anti-coagulant. Right? Anticoagulants. You're going to go to page 707 and you're going to see them in a box 51-1. You see that? Now, so anticoagulants are for clots. Bunsan, right? No matter why the bunsan is, we don't care. We just got a clot, we need to break it. Now, the first anticoagulant is Coumadin. Coumadin only come in pill form. Like an IV. Only come in pill form. Coumadin comes in pill form. Coumadin take a long time to work. 7 to 10 days. Coumadin passes through the blood barrier. So if I had a DVT while I was giving birth, I have a clot, and I'm breastfeeding, Coumadin wouldn't be the drug for me. Why? Because my baby Shakita will bleed. Now, Coumadin takes a while to work. It only comes in pills. But every time you take Coumadin, you must do a blood test called PT-INR. Now, 3 ladies up front. She who don't have a clotting problem, but she came to the hospital and she had 1 clot for the first time. She don't have a history. She just had a clot for the first time. This lady who had valve disease, and once you have valve disease, you at risk for AFib. So we gonna put her on Coumadin. She been on Coumadin for 30 years. This lady who all of a sudden decided to go on birth control, she got clots. So we got 3 different scenarios. My lady here, who never been on Coumadin. This is her first time, and I decide to write her an order for Coumadin. Her PT-INR will be 2 to 3. Right here. 1.3 to 2. Pardon. 1.3 to 2. 1.3 to 2. My girl here, because she on Coumadin for the first time. With no history. Miss Susan been on Coumadin for 30 years. Her PT-INR 3 to 4.5. Her lady here, she just started, right? Back. Now she had Coumadin before, but she didn't have clot. She had a clot. Then they gave her Coumadin. Then she didn't have the clot. Then she went back on birth control. Now she got the clot again. So she jumped back and forth. Her PT-INR would be 2 to 3. Here is y'all problem. NCLEX give you a PT-INR and you jump. You don't look at the patient history because her PT-INR is different. Her PT-INR is different, and her PT-INR is different. What they all have in common is they take Coumadin, but they taking it for different what? Reason. Clot, but for different what? Different reason of getting the clot. You understand? Any question? So you got to read, because Susan, I cannot expect Susan Coumadin to be 2.3. Susan been on Coumadin for how long?
30
years. Any question? Yes.
Okay, so the one that was, that has been taking Coumadin for a while. So if the lab shows that she's 3 or 4, is that normal?
Normal for her.
For her, oh.
Not normal for my girl here, and not normal for my girl here. For her, it's normal. So you cannot look at the PT-INR. You got to look at the patient. There you go. And that is y'all problem. On my mama, papa, cardiorespiratory neuro, I get y'all strong. I give you a PT-INR, you poop. You give me something. You didn't even read the scenario. Read to see who is getting the what? Coumadin. Any question? Yes. Not PT-INR. 3 to 4.5, and it's in your book. Nice. There's 3 different PT-INR. But the school only taught you 1, 2 to 3. Yes.
Just come at the facility. Every time you have a PT-INR 3, when you call the doctor, they say put it on hold. They think about it.
Yes, but they say put it on hold because I guarantee you the doctor know the patient history. You got to look at the patient history. You got to look at the patient history. Because a patient who's been on it for years, her body is tolerant to it. That means she needs more of it. If I've been taking a drug for 50 years, honey, I need more of it because my body is, yes, very important. Okay, now, any question? We cool? Now, warfarin, Coumadin, PO only. Fragment is just like a Lovenox, right? Lovenox, you give it to prevent the bull. Lovenox fragment. If I have the bull already, that's not the drug for me. Prevent and have. To prevent a bull, you're going to give me Lovenox fragment. If I have the bull, you're going to give me Heparin. And when I go home, you're going to give me Coumadin. But you need to break the bull now. See, the problem with the student, you said Lovenox is an anti-coagulant. No. Lovenox, prevent. Heparin, break and prevent. Coumadin, break and prevent, but it takes a long time because it's PO. So if I have a bull right now, Coumadin is not the drug of choice. Heparin. Now, if I'm hospitalized, I had knee surgery, and I'm not moving, will you give me heparin? No. Why? Because the bull is not there. The clot is not there. So you want to give me things to prevent. Novanox, fragment. Now, watch. She got history of clots. She just got a knee replacement. Am I going to give her Lovenox? No. What am I going to give her? Heparin. Because she has history of what? Of Coagulant. Any question? Again, she had no history. She being hospitalized. No history. We don't want her to get a bull. So we going to give her what? Lovenox or fragment. They call those low molecular. Shannon, on birth control, she got history of DVT. Shannon getting a knee replacement. She had knee replacement surgery. You know why you going to give her heparin? Because she got history. Not because the bull is there. It's because Shannon is 1 foot in, 1 foot out. There you go. Any question? Now, NCLEX asks you PTT. And the students say, PTT, prothrombin. That's not what they ask you. Oh. They ask you what PTT means. Not to read it out. Hell, we all could read it out. I want to know, miss, you told me PTT. What PTT mean? Here it is. How long it take you to clot. That's it. How long it takes you to clot. And PTT, listen, goes with everything. Everything. Now, do we? Listen, and you're going to say me, but the school say, what kutim. PTT is known, is good for everything. PTINR is made for Coumadin. PTT, you can ask for PTT in everything because the definition of PTT is for how long it takes you to clot. But heparin is the main husband, what we use PTT for. For example, PTT, the normal PTT is 20 to 37 seconds time 2. Anytime they give you a low PTT like this, 20, 37, you have to time it by 2. Anytime they give you a big number, they already timed it for you. English. Let me say it again. Anytime they gave you a PTT 20, let's say they gave you a PTT of 24, you have to time it by 2. Anytime they give you a PTT 7280, they did the math for you. So, if PTT is how long it takes you to clot, let me explain to you what that means. If I take a knife and I cut Shannon, and I put pressure on Shannon, and Shannon don't start clotting, Shannon is going to bleed. Right? So PTT is how long it takes you to clot. Because once you start clotting, you stop bleeding. So, if I cut Shannon, right? Because I told you PTT is 20 to 37 times chill. So 20 times 2 is what? 40. All right. These seconds. 37 times 2 is what? 74 seconds. Now, there's 60 seconds in 1 minute. If I cut Shannon, and it took Shannon 80 seconds to start clotting, what am I going to see on Shannon? A lot of blood. That's why you want your PTT in this range here, 40 to 74. Anytime PTT 76, 78, 80, 90, whoa, patient is patient at risk for bleeding. That's it. Any question? All right. Pamit sel, pamit citron, no babat. Oh, Jesus, I shouldn't say that. It's okay. My mom would die. I didn't mean it. So make sure. And remember, what do we use PTT for? You know how Jamaicans is known for curry, Haitian is known for griot. Okay, PTT can use for everything, but what it's really, number one reason why it's made for heparin. You got it? All right. Any question the difference between PTINR and PTT? Now, anytime you give an anti-coagulant, pubul, pufanbul, you will always check PTT, HNH, platelet, because all of that is with what family? Bleeding. Aspirin. Aspirin is an anti-platelet. Did we mix aspirin with anti-coagulant? Now, let me try to differentiate those for you. Bull, break it, heparin. Aspirin, don't break bull. Aspirin make blood flow nice. Okay, that's why they call it anti-platelet. Make blood flow. Now, lazy instructors say blood thinner. Everything blood thinner. That's not true. I understand why they say blood thinner. Hey, soup from bull, say blood thinner. See blood flow nice, say blood thinner. So the teacher will say blood thinner for everything, and the student say blood thinner. But you need to understand what type of blood thinner is what. Any question? Try somebody real fine coming here. Hey, oh my God, I woke y'all up. You, this door? No, I'm just kidding. Oh, Jesus, I'm bad. All right, let's go. Just walk. You know. Tom, I'm so embarrassed. All right, let's go. All right. Okay, I lost my, ooh, hallelujah. Pray for me. Okay, Natalie, where was I? There's something important. Shh. Okay, Coumadin, listen. Coumadin, heparin, anytime you give anti-coagulant, period. There's an antidote. and it's called vitamin K. The problem with students only think vitamin K only for Coumadin because that's what the school taught you. Vitamin K is for heparin. Vitamin K is also for Coumadin. Anytime you give an anticoagulant, the antidote is vitamin K. Where would you find vitamin K? In green leafy vegetables. There you go. So, because the school taught you Coumadin only vitamin K, you forget about heparin. Anytime you take any anticoagulant, you must know the antidote is. Now, LPN, licensed practical nurse. Why will I lose my job? Oh, if you get a Coumadin order and you don't initiate it, fired. You better start it. That is a life or death medication. If you got an order for vitamin K, ooh, and you left it for Shannon to do, hell, you ran out of time. Guess what? You better go job hunting. You're going to get written up. Blood, nitroglycerin, vitamin K, Coumadin, you better initiate those orders. Right, LPN? You're going to get written up if they don't turn you in the board of nursing. That is negligence time 50. Anytime a patient don't want blood, you better call the doctor. Blood, nitroglycerin, vitamin K, Coumadin. You don't play with those drugs. Those are life and death medication. Any question? No attorney gonna help you on this one. Okay? We cool. Now, anytime you give anticoagulant, right? We need to watch the patient for bleeding. Blood coming everywhere, nose, rear, petechiae, ecchymotic. You need to check the patient because they are at risk for what? Easy bruising, bleeding, tarry stools. Any question on anticoagulants? We cool? So anticoagulants are given for clots, bullsong, right? Heparin to prevent and break. Lovenox fragment to prevent. We could, yes. Anti-platelet. Okay, and you'll see it. Now we go to box 51-2. There go where NCLEX gonna get you. The patient is on anticoagulant. Which drug would you question? Ready? If I take allopurinol with Coumadin, I'm going to bleed 50 million times. Why? Because allopurinol causes bleeding. Coumadin causes bleeding. So if I give them to Rose, she double bleeding. They get you this. If the patient is on this, which one would you question? There you go. Tagamet. What do we give Tagamet for? Ulcer. So do you see if I'm going to have surgery, you need to stop the Tagamet how many days before?
48 hours.
48 hours. Steroids. Bleeding. Green leafy vegetables. Do it cause me to bleed? Do it make the medication don't work?
Make it don't work.
Don't work. Good job. You see, anytime I'm taking anticoagulant, I need to watch these drugs. Oral hypoglycemic, metformin. Boy, everybody know metformin, right? Any diabetic medication, you stop 48, 72 hours before and after. Dilantin, bleeding. Aspirin, night class. Where did you learn that sulfonamides? Antibiotics. Antibiotics that has sulfur in them. Silver nitrate, silverdine. Cause bleeding. Ginkgo. What ginkgo used for? Memory. That's why every time you're going to have surgery, You make sure you don't take no what? Any question? Make sure you do. You see, I just did the studying for you. You see, nice and neat. Don't go read more. Right? Yes, ma'am.
And the teaching, when the patient is on coma, you tell the patient not to increase or decrease the
Hold on. You don't, you just tell them to make sure they don't eat a lot because it's going to make the medication don't work. That's very important. They don't increase or decrease. Just whatever they used to eat, they can continue to eat. That's very, very, very important. Right? Any question on anticoagulant? So you go to NCLEX and they ask you your anticoagulants. They are your what? Your Coumadin? Your Heparin. Now, our nurses, let's talk about Heparin. Heparin need to be witnessed. IV Heparin. Pump needs to be witnessed. We need to weigh you daily when you on Heparin. Normally, anytime I give Heparin IV, I must hospitalize you. Yes. Uh-huh. All right. If it's less than 20 seconds, what that mean? They're clocking too much. You need to check which lab. Platelet. There's a platelet issue. Okay? Now, Coumadin. Ready? You remember with the Susan situation? Let's say Susan is a 7. Remember, she can go 3 to 4.5. Let's say Susan 5.5. What would you do? Hold it. Call the doctor. What happened if Susan is 2.5? You will give it and call the doctor. You will never increase Coumadin. You will never decrease it. You will just hold it. You don't tell the person to double up on a Coumadin. Any question? We cool? All right. Then we go to Dwambolitik. Now, that's where this comes in. Stroke. Guys, when we say stroke, we're talking about the brain, neural. So anytime a patient have a stroke, ischemia, bulsan, this is tragic. So we need something to break. So here it is. Heparin, fun. Right? That's a pretty word. Dwambolitik, burst. Burst. It bursts, but it can kill you too. So that's why when a patient have a simple thing as DVT, we don't go give Dwambolitik. We give Dwambolitik for go bagay, big stuff like ischemia, stroke. Because Dwambolitik is traumatized. It's a good drug, but it can kill you quick too. Now, that Dwambolitik drugs end with a vase. Streptokinase, activase, septoplase, the poor place. It's Dwambolitik. You see? Activase, reactivase, streptokinase, ticanase, ACE. Right there, you know Dwambolitik. Now, I want you to go where it says B, and I want you to highlight that, and I want you to put, I cannot go to NCLEX without reading this part, B. Contraindication, I want you to put, who cannot get ACE? Who can I not give ACE to? Very big on NCLEX. Guys, anytime I found her floor, had ischemia stroke. I caught her 4 hours after she fainted. If I give her streptokinase, I just killed her. That is why when you find a stroke patient, no oxygen on the floor, you see these old ladies, nobody go check on them. There's something called posturing, position. Either they're going to position decorticate or decerebrate. If you see this, that means they haven't been there more than 4 hours, give it to them. If you see they hand like this, then decerebrate, you give them. Case, they're gone already anyways. You do not give a stroke patient case, Dwambolitik, if you find them more than 4 hours. So let's go. Who cannot get this? Anybody who have history of bleeding, you don't get this. Brain attack, bleeding, intracranial problem, right? History of thoracic, pelvic, abdomen surgery. History of liver and kidney. People who have uncontrolled hypertension. Recently required prolonged CPR. Known allergy. These people cannot get Dwambolitik. That is why Dwambolitik will never be the drug of choice for someone who have a PE, DVT. I'm safer with heparin. I will give you heparin before I give you this. Guys, as an ER nurse, the only time we administer this in the ER is when the patient come with a stroke, bullseye, ischemia. Now this is medical emergent. But for a lady who on birth control got DVT, child, we stick the heparin. This too much. You gotta check 50 mil kidney, this and that. And suppose she don't know she have high blood pressure. Oh, you go give her this. Guess what? You just killed the lady. There's so many lawsuits on this drug. Any question? Side effect, bleeding. Boy, this patient bleed all in the inside. Bullshit, bleeding everywhere. Dysrhythmias, fever, right? Allergic reaction. They can have anaphylactic. Now, intervention, obtain a PTT, PT. You see that? That's why, guys, I didn't give them heparin. Why I checked the PTT. The problem with students, y'all only think PTT only for heparin. PTT is for everything except Coumadin. Coumadin, its job, PTINR. That's for you. PTT for everything. Only Lovenox and Fragment, they won't check PTT. They just will check to see how your H&A. Hell, they don't even check labs on those. Yeah, but here, you can check PTT. Heparin, you can check PTT. School taught us PTT, heparin. Any question? And how you know the patient is bleeding in the brain or the drug, the patient is bleeding? LOC. Oh, okay. Who am I? Who are you? Who? The drug, very strong. You talking about lawsuit? Right here. And nobody want lawsuit. Now, then yes, ma'am. Okay, yes. Protamine. Yes, you're right. You can give, no, they say protamine sulfate for heparin and Coumadin vitamin K. But what I'm telling you, vitamin K also with heparin. And if you do questions, you will see that. Okay? All right. Now, then we go into antiplatelet. Mom, she asked for Plavix. Guys, this, yes.
Can you go over the first target,
When the patient have a stroke, whether it's bleeding or bulsa, they start to posture. Posturing meaning, and we'll do that in neuro, when we do neuro, lack of oxygen. Either if I have a clot, no oxygen is flowing. If I'm bleeding, no oxygen. So the patient started posturing. This here is decorticate, and this is decerebrate, which is deceased. So decorticate, that means life. Decerebrate, deceased more. They're gone. So you gotta see what position the patient is in. Okay, yes.
The person have PE, if the second block is gone.
If the patient have PE, you gotta see how bad is the PE. The safest drug, see, early sign of PE is the patient heart rate start going fast and the patient lethargy. If you come to the ER, you already turned blue. We right here, we may give you this because it's grave. But if we suspect a PE, we don't even know child will start hanging. Heparin. It depends on how grave the situation is. Anytime we give you thrombolytic, you're not on a regular floor. Yep, you on the unit, baby. Okay, yes.
So you said thrombolytic we have to give within 4 hours?
We have to find the patient. Anytime you find the patient 8 hours, 4 hours after that, thrombolytic will not work. You never give it to a stroke victim that you found 8 hours, or you don't even know how long she been there. Okay? All right, then we go to antiplatelet, Plavix, Ticlid, antiplatelet to help aggregation of platelet in the clotting process. Antiplatelet pafundbula. That's not what its job to break clot. It's to make the blood what? The clot smooth so it doesn't stick together. So who do we give Plavix to? What disease? Peripheral arterial disease. Peripheral arterial disease is you want the blood to flow. Aspirin, Ticlid, Repro, those are antiplatelet. It's not, some people call blood thinner. Yes, it is. Everything is blood thinner. But it is just like what? Aspirin. Right? Now, what lab you would check for antiplatelet? Right? Yes, you can easily check PTT, right? H&H, right? Clotting factors, right? Make sure you know that. Check for bruising, hematuria, tarry stools. Any question? And let me tell you something about antiplatelet. They're like aspirin, so you better take it with food. You ever took Motrin with no food? You ever took aspirin with no food? It causes GI upset. So you take these with food. Yes?
Sonia, they don't really use the Coumadin anymore. They more use Xarelto instead of Coumadin.
Huh?
Xarelto.
Yeah. Okay, Xarelto is a very new drug. It came probably 2012. The reason Xarelto is like the new drug of the new drug is because with Xarelto you don't have to do PT-INR. And with Xarelto, the food issue. Because what happened is, guys, if a medication is not easy, I have to go do blood work, I gotta watch what I eat, I'm less compliance. Xarelto, it's made it easy for you. So the patient don't have to go and do. You have to do blood work, but not like PT-INR, like the way you used to do it. First every week, then it's every 2 weeks, then every month. That's just too much, right? So that's why, yes, Xarelto is the drug of choice. Every 5 o'clock, you see it on television instead of Coumadin. But Coumadin is old. It's still there. It's old and it's cheap. Okay? Now. Any question? Then our last drugs, and I'll let you go. Watch. I'm going to go into Mr. Digoxin, right? Y'all say, oh, Lord. Okay. Miss Sonia, why do you give Digoxin? Students confuse this. First of all, there is 2 sides of the heart, right? There is a left side and a right side, right? The heart failure goes like this. First, the left side go bad, and then the right side go bad. Then when both go bad, we call it CHF, congestive heart failure. So, Miss Sonia, show me how the heart can go bad. When the heart go bad, it's not because it's a clot. The heart is bad because it's a pumping problem. See, you use anti-coagulant because Dwambolitik, there's a clot. You use Digoxin not cause a clot. It's because the heart is not pumping like it's supposed to pump. So, let's go of the heart. Let me show you how the heart goes. This is you, Yaya. Once the blood goes to the body, it is considered dirty. We call it deoxygenated blood. So let's go. Right atrium. Tricuspids say, come in, you dirty blood, because I'm immigration. So immigration accept this blood. The body knows the only type of blood that goes in the right side is dirty blood. Now, the tricuspid push it into the right ventricle. And the right ventricle push it to the pulmonary valve. Pulmonary valve say, hi, dirty blood. You supposed to be here. Now, the pulmonary valve push it to the lung. And the lung washes the blood. And that becomes oxygenated blood. So now I'm here. It's clean. It has to go to left atrium, mitral valve, the only type of blood that goes on the left side of the heart is oxygenated blood, because this blood is going to get ready to go back to the body and the process start over. So mitral valve say, come in, you dirty, you clean blood. Left ventricle, aortic, push it to the aorta, pressure build up. And what is that pressure called? Ejection fraction. So I'm able to get blood from head to toe, and the process turned around. And it happened again. Now, when you have left heart failure, watch. Yeah. Right atrium, dirty blood. Right ventricle, dirty blood. Pulmonary valve, push it to the lung. Clean. Watch. Now this push it to here. It's broken. It's broken. So, where does the blood stay? In the lungs. Stop. So the blood stays in the lung because the left side is broken. So, when you have heart failure, left, you got 2 problems. One problem, water in lung. Ça son problème. Second problem, the heart not working. So you gotta give me 2 drugs. Let's remove the water from the lung first. You going to give Lasix. Not for the heart, to remove the water from the lung. That's no problem. You guys know when you give Lasix, your potassium is what? Low. All right. So in heart failure, we give Lasix. Is it to fix the broken heart? No. It's to get Lasix to remove the what? Yeah. Now, while Lasix removing the water, it also lower your what? Potassium and your what? Blood pressure. Keep that in mind. Now, then we got a bigger fish to fry. Now, when the heart is broken, where is the water? In the lung. So do you see why I am hypotension body? Because the water is in the where? Do you see why I am tachycardia? Because the heart is saying, fast, hey blood, where are you? Hi, blood, where are you? Where's the blood? So the heart is beating what? And the body has what? Low what? Low blood. So when you have left heart failure, you are tachycardia, hypotension. Now, because all the blood is in the lung. Now, I'm going to give you the digoxin, which is called a positive inotropic. Now, Miss Sonia, what does that mean? It increases contractility. Oh, Miss Sonia, what that contractility mean? Heart like beat fast. Kote increase contractility because the beating fast that the heart is doing, it's ugly. It's going ba 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 ba. We don't want that. We want love, dub. Love, dub. We don't want love, dub, love. We don't want that. We don't want S1, S2, S3. We want S1, boom, S2. So what is the heart doing is S1, S2, S3. So we're going to give a positive inotropic to make it go up and to come back beautiful. Boom, 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 boom. That is why you give digoxin. But digoxin, if you give too much, you got problems. So let's see. Anytime you give digoxin, you must check blood level. The blood level of digoxin is 0.5 to 2. Now, you remember Lasix, when you give it, it makes potassium low. You remember? But now, when you give the digoxin and you give too much, not only the patient will have eye problem, the patient will have nausea and vomiting, and the potassium will be low. If you give too little digoxin, potassium will be high. So here it is. If you give too much digoxin, potassium will be low. Eye problem, GI problem. If you give too much digoxin. The antidote for too much digoxin is called Digiban, number 15 in your book. Digiban. Or another word, they call it Digfab, Digiban. When you give too much digoxin. So the normal digoxin is 0.5 to 2. So if the patient level is 2.3, that means I gave too much. So I'm going to see low potassium, eye problem, GI problem. And the antidote is Digiban, number 15 in your book. Now, if I give too little digoxin, right? Too little, the patient potassium is high. And what drug you give for high potassium? Coagulant or insulin. So isn't it fair anytime a patient is on digoxin, by me checking your potassium can tell me how you've been taking your what? Digoxin. Anytime you take digoxin, you must take apical pulse. How long apical pulse? 1 minute. Make sure you know that. Anytime you give digoxin and the apical pulse is 60, you will hold it. Because if you give that digoxin, it will make it lower. Yes?
Can you repeat that for me again? When do you give the Coagulant?
You give the Coagulant when you give too little digoxin, which make potassium high. Nobody in my review better say you give digoxin for hypertension. Or am I comprimé today or prend gasoline? You don't say that. You give digoxin for what? Heart failure. To remove the water from the lungs by LASIX. When you have right heart failure, for the heart, you give what? Digoxin. In right heart failure, where's the water? In the body. So to remove the water from the body, you give what? LASIK. Don't nobody tell no, ooh, don't you say that out loud. Puis on m'a dit what digoxin et puis soudainement dit hypertension. Y'a fait mon. Don't ever. Somebody asks you why you give digoxin. Say, ma'am, you give it for heart failure. Ufini. What is it? Positive inotropic. You got to understand. I never said for no hypertension. Oh, baby, all right. Any question? We gonna stop. You see, heart. I cannot rush it. I cannot. It's very tedious, and I gotta give it nice. Please, let me give you something for next week. Yes. Shh. Come on now. Give them what? Because diclomycin is a baby LASIX. It's not. You give diclomycin when it has to do with kidney.